You're listening to Beyond the Endpoint, a podcast from the Duke Clinical Research Institute. In this series, we're demystifying clinical research and answering your pressing questions about health and healthcare. You can find our full episodes at dcri.org/BTE.
To say there's been growing interest in today's topic over the past year would be quite the understatement. While autism has gained attention in both political discussions and media coverage, this heightened visibility hasn't necessarily led to greater clarity. In fact, the emergence of competing narratives has only deepened the complexity and misunderstandings surrounding the science. That's why we're especially excited to welcome a leading expert in the field today to Beyond the Endpoint. In today's episode, we'll explore the current state of autism research, what we know, what remains uncertain, and where the science may be headed next. I'm Dr. Emily O'Brien, a population health researcher at the Duke Clinical Research Institute. I'm joined by my colleague, Dr. Manesh Patel, head of cardiology at Duke Medicine and a DCRI faculty member.
Thanks, Emily. Today, we're sitting down with Dr. Franz, who currently leads the Duke Center for Autism and Brain Development. Dr. Franz is a board-certified child and adolescent psychiatrist with extensive experience in autism research. She served as the principal investigator, co-investigator, and a medical director on both behavioral and medical clinical trials. Her work also includes collaborating in studies that use AI and machine learning to analyze medical records, which are helping to predict the likelihood of autism and to better understand developmental trajectories in children. Thanks so much for joining us, Lauren.
Yeah, thank you so much for inviting me to have a conversation with you all today. I'm excited to be here.
As you can imagine, we've been thinking a lot about this conversation, and maybe just to get us started and on the same page, what is autism?
So, autism is a neurodevelopmental condition that affects how people may think, feel, interact with others. It's called a spectrum because we're very aware now that it looks different in different people, with some autistic individuals needing a lot of help and support across their lifetime, and others living very independently. There are actually three key autism traits that are specific to the condition. The first are social differences, the second are repetitive behaviors, and the third are sensory sensitivities. And I'll explain that a little bit. So, when we talk about social differences, that could mean that autistic people may find it hard to make eye contact or understand other people's body language, or even start or continue conversations, keep conversations going. In terms of repetitive behaviors, autistic individuals may repeat words or actions, need to follow very strict routines, and have very strong interests in specific topics. And then finally, in terms of sensory sensitivities, that can mean feeling sort of easily overwhelmed by things like loud noise or certain textures or bright lights.
There's been a ton of activity in the research space over the past several decades related to autism and factors that may contribute to its development and the best ways to provide interventions and support where appropriate. Can you talk a little bit about how our understanding and definition of autism has changed and how those changes might have impacted who gets diagnosed and when?
Sure, I'm happy to talk about that. I think what also might be helpful to talk a little bit about are some common misunderstandings of autism as well that have, of course, evolved over time. So I think a few I'd like to highlight is that autism is not a lack of empathy. So many autistic people actually feel emotions very deeply and care very deeply around people around them. They may just express it in a way that is different, right? But just because they do that, it doesn't mean they don't have empathy. I think another thing to highlight here is that autism is not a disease. It's not something that can be cured. It's usually a lifelong condition that shapes how individuals experience the world. It's also not what we would consider a mental illness. We would consider it a developmental difference. It's not a psychiatric disorder like depression and anxiety, which are actually conditions that can often co-occur with autism. And then autism is not always very obvious. Some people with autism may seem very quote unquote typical, but may face sort of more internal challenges. And others may have very clear, visible traits of autism. And I think our understanding has changed significantly, over the past 100 years or so. So I'll just give a few examples. So I think in the early 1900s to 1950s, autism was actually confused with schizophrenia. Folks even thought that it was caused by cold and distant mothers. So fortunately, that was a theory that was debunked. Between the 1960s and 1990s, folks became aware that autism was actually a spectrum of different traits. It's separated diagnostically from schizophrenia. And importantly, better diagnostic tools were actually developed. How we see autism now is more of a spectrum. We recognize it as a brain condition that actually starts in the prenatal period, meaning before the baby is even born. It's due to a combination of genetic and environmental factors, with genetic factors playing a more significant role. And importantly, it's not one condition, it's many different conditions with many different causes.
That's really helpful, and I think that's helped me better understand it. Is there genetic evidence for autism risk?
Autism is a complex condition, and what we do know is that hundreds of different genes can play a role in the development of autism. Scientists believe that both common and rare genetic causes can add up, increasing a person's likelihood of developing autism. And when genetic factors combine with environmental influences, they can push somebody over a certain threshold, leading to the development of autism. Most autism cases are influenced by what we would call common genetic variation that's inherited from parents, with heritability estimates ranging from about 60 to 85%. But there are rare mutations that can also play a role, with about 15 to 20% of autism cases linked to rare genetic mutations. And these rare genetic mutations can be inherited or they can happen spontaneously, meaning they can occur for the first time in a child and they're not passed down from parents. And some of these mutations can be tied to specific genetic conditions like Fragile X. And I think the last thing that I'd just like to highlight here around the genetic factors that influence autism is that most autism genes are actually active during early brain development before the child was born. And these genes can help shape how the brain is built and how it functions, and influence things such as how brain cells communicate with each other and how signals are sent and received between brain cells.
Yeah, I mean, it's a great summary of a complex set of contributors that it sounds like we understand a lot better than we did, but certainly have more work to do. I'd like us to move for a minute from the sort of epi discussion to one about health services research. And you mentioned that autism is not all one thing. How does that play out in terms of interventions or supports that are available for people with autism and their families and communities? What do interventions look like today?
So thank you for that question, Emily. And I think, autism interventions actually refer to a wide range of therapies that are designed to support autistic individuals develop skills, reduce challenges they may experience, and also, very importantly, improve their quality of life. And when we talk about interventional therapies, these are things that specifically aim to change development or behavior, like improve communication or social interaction abilities. But very importantly, therapies or interventions should really be tailored to the unique needs of each autistic person. There's no one size fits all. And they also need to be tailored to individuals' strengths and challenges and their goals. And very importantly, autistic individuals, as much as possible, need to be actively involved in decision making about the supports and therapies they receive. But it's also very important that these start as early as possible. So I'll just briefly summarize some main therapies or interventions that we think about in this area. The first one are behavioral interventions, things like applied behavior analysis that can help individuals learn new skills and respond to situations maybe in more effective ways. Speech and language therapy is another intervention approach that can specifically help improve communication and provide supports around things called augmentative and alternative communications that are devices that can actually help people who have difficulty speaking or cannot speak at all learn to communicate. Occupational therapy is another important therapy or intervention, and this can teach things like daily living skills such as dressing and maybe eating independently. Social skills training can support things like skill building around social interactions and communication. Cognitive behavioral therapy is another approach that can help manage frequently co-occurring conditions like anxiety or depression but also things like emotion dysregulation that frequently co-occur with autism. Medications can be used to treat co-occurring conditions like anxiety or ADHD. And then, very importantly, special education, which can provide a tailored learning environment and include what we call accommodations that help autistic individuals learn and participate more comfortably in their environment. So, things, for example, like having extra time on tests or wearing noise canceling headphones in environments that can be overstimulating.
This is Beyond the Endpoint, a podcast where we bring personal and expert perspectives on healthcare and clinical research to the casual listener. Stay tuned after the interview for a breakdown with the hosts. They'll talk through key takeaways and what this week's topic means for you.
You know, we've talked about some of the possible genetic links, and we talked a little bit about interventions. What do we know about environmental factors in autism?
Yeah, so, while genetics can play a major role in autism, parental and birth factors, environmental factors more broadly, and then pregnancy-related factors can increase the chances of autism. So I'll go through that in a bit more detail. So if we start off by thinking about parental and birth factors, older parental age, particularly in fathers, may slightly increase the likelihood of autism. And that's because, tiny changes in DNA that build up over time from things like medications and toxins and diet can sort of change our DNA. Another bucket to think about here is preterm birth, especially before 32 weeks. That makes autism about 4 times more likely. And then complications during birth, like lack of oxygen or physical birth trauma, may also play a role. Then thinking about things like maternal health and pregnancy, maternal obesity and diabetes are known factors that can lead to chronic inflammation, which may affect how the baby's brain develops over time. Certain medications in pregnancy, like valproic acid, for example, have been known to be linked to autism. And then, another sort of bucket around environmental exposures has to do with things like air pollution, especially nitrogen dioxide, which may increase the likelihood of autism. Tylenol, there are some studies that suggest a possible link to autism, but the evidence is currently inconclusive. We know that research does not support a link between SSRIs, which are selective serotonin uptake inhibitors, which are a type of antidepressants, taking that during pregnancy and autism. And then finally, extensive, well-designed studies, including major research that has been conducted in Denmark and Finland and California, as well as a meta-analysis of 10 studies that involve over 1 million children, have found no link between the MMR vaccine or other vaccines and autism.
That's a really great overview. Thank you, Lauren. And as we think about risk factors, I think the natural kind of direction for people who work in population health sciences is like, well, how good can we get in terms of identifying potential contributing factors and populations who might have higher likelihood? And then that might give us a better chance for early detection. And as you said, early intervention and therapies and support are also important. Can you talk a little bit about sort of the state of the world for detection and any innovations that you think have been pretty exciting in terms of moving the needle for early identification and potentially early intervention?
Sure. So we're actually doing some innovative work around early detection here at Duke. And I'll highlight one sort of direction of research in particular. And this is work that we're doing at the Duke Center for Autism. That's part of our Autism Center of Excellence Award from the National Institute of Health. It includes a multidisciplinary team of clinicians and researchers, which is always the best combination to do great science. And it's really focused on improving early detection of individuals who are at high likelihood for autism. And, the reason why this work is still very, very important is because even though we've made sort of great strides in what we know about autism and our ability to diagnose autism, which we can do reliably by 2 years of age, the average age of diagnosis in the United States is around 47 months, right? So that's a big gap between when we can diagnose and when it's actually happening. And we also know that there's significant regional variation in age of diagnosis, which we think is related to service access and availability. So in one of our Duke studies, researchers are using artificial intelligence to analyze routine medical data, such as diagnostic codes, vital signs, medical procedures, visit types, and also medication that are stored in electronic health records. And by just 30 days after birth, in work that's actually been led by Dr. Matt Engelhard, who's an assistant professor of biostatistics and bioinformatics here at Duke, these AI tools can already detect patterns that are linked to autism, such as early gastrointestinal problems or visits to specialists like neurologists and physical therapists. And they can actually provide, in the longer run, timely information about autism likelihood that we can use to complement standard care and make screening more consistent and objective. And what we're actually focusing right now is developing an AI-based clinical decision support tool that can provide this timely, personalized information on autism likelihood to clinicians and families at the point of care. Investigating what we're really busy doing now is like, what is the right time to communicate this information? What's the right way to communicate it to alert both providers and caregivers in a way that really supports shared decision making around next steps that will involve referral for formal diagnostic testing, but then also linkage to intervention services. So that's just one example of innovative work that's going on in this space.
That's really great, Lauren, and really moving the needle, hopefully. What's the role of community in autism?
Yeah, so, the autism community is a very broad and very diverse group of people that are connected to autism in different ways. And it includes autistic individuals themselves, family members like parents and siblings and extended family members, clinicians and educators, as well as researchers and policymakers. And, as a whole, the efforts from this autism community have really focused on building understanding and acceptance around autism, decreasing stigma, advocating and creating inclusive environments, and then expanding the autism research agenda. So I think as a whole, it's remarkable the impact that they've had on transforming the field. The community has actually broadened as well over the past few decades in terms of who's included in the conversation. And specifically in the past few decades, the neurodiversity movement has emerged, which really promotes acceptance and inclusion and respect for people whose brains work differently, right? And this movement, I really think, has been instrumental in ensuring that autistic perspectives are included as part of this community and importantly in all decisions that impact them. This phrase of nothing about us without us, right, is really core to this movement. So just to share an example, in our ongoing Autism Center of Excellence, a program of research, at least for the past 5 years, we've had a community engagement advisory board, which includes various members of the autism community. And I've mentioned how diverse they are, and that's who we have represented on our board. And this board has really been instrumental in providing key perspective that I think has helped shape the focus of grants that have been written. That's sort of a spin-off of our Autism Center of Excellence program of research. And they've also worked with different research team members to interpret study findings and then collaborated with us on more public-facing materials, right, that have to do with how we disseminate our research findings, like plain language summaries of the grants we're doing, like why are we doing these grants, plain language summaries of peer-reviewed publications that have been published in scientific journals, and then collaboration on our most recent What is the Autism Spectrum video that's available on the YouTube channel. So I think including various community members in research can really be transformative and connect us more broadly with impactful work.
Yeah, I mean, we are always thinking about ways to do that more effectively, ways to be more inclusive about that process at the DCRI. And it's so wonderful to be able to hear you talk about what you're doing and how that's really brought a richness and key perspective to the work that you're proposing, the work that you're leading. So thank you so much for sharing.
Lauren, I'm thinking as we kind of round out our podcast, is there anything else you would want us to know about the lived experience of the autism community? Any other points you wanted to make to us about how it's working together?
Yeah, I think, we've learned a lot about autism, but we continue to learn a lot about autism. So I think staying humble and realizing that we do not know everything is really important. I think that we are doing a much better job in identifying groups that were traditionally under-identified, and that includes women and girls, as well as individuals from racial and ethnic minority groups across the United States. So, I think as we learn more about what autism looks like and its impact on individuals' lives, we'll learn more about the priorities that we need to be focusing on moving forward.
Well, I'll just say I really appreciate you joining us today. It's been a really informative conversation. And, as someone who's trying to learn more about it, it's been really valuable for us to hear from you who are so in depth with the community and the work, the research, the science. I think your final message is probably the message we could say for a lot of Beyond the Endpoint, which is to stay curious and humble and understand there are many perspectives and understand ways in which we can better affect each other's lives. So we really appreciate you joining us.
Yeah, thank you so much.
Well, that was really a great podcast. There's a lot of conversation I think we all have about things we think we know. And, even being in fields we're in teaches us just how much more we have to learn. I thought the conversation around what autism is and the interventions that are possible was quite robust. I'd be interested in what your thoughts are.
Yeah, I mean, I think Lauren did such a nice job of summarizing what is a really complex topic and also one that is changing so quickly because fortunately we've had a lot of, I think, really fantastic and robust science, some of which has been led here at Duke to better understand the contributors and the best treatments and the best supports, to offer to this community, and to do that in a way that engages that community in meaningful conversations and really tries to keep that perspective at the center of the questions that we ask and research. And so to hear that firsthand from someone who's really at the front lines of this was really interesting and kind of cutting through all the noise that's out there on this topic. And I think just really inspiring perspective on not only how far we've come, but also some really exciting future directions.
Yeah, and I think for us and for me, I took it to mean, there just as she sort of ended it, which is it's important to be curious and recognize where we can be humble because some of the information changes and our understanding of it changes, but include the people involved, the community involved, and have it directed in questions that matter most to the families and the people with autism is really valuable. The second thing I gathered from it is just how fast some of the science and some of the things are going to be moving. So that's good because I think it's important for us to continue to learn. It does sort of get to these two things that have been themes for us with Beyond the Endpoint. One is just how science is conducted across multiple types of areas. And I think this is quite an interesting conversation for us because we think about both the scientific method, but then we also think about the science behind associations, information, how we learn. And I think this is really the value of the Beyond the Endpoint is including the people, as she said, and nothing about us without us. And it's really a powerful statement about how anyone with the scientific interest or an interest to serve a group of people should include those people. And then the science of it, which is something I know, care a lot about how do we humbly continue to push the information as best we can forward to help people. So I really enjoyed it because I think it's going to be an important topic for us to continue to think about.
Yeah, I mean, it's a really fantastic model, kind of no matter what therapeutic area we focus on in science and in medicine, right? I think to me, the big factor, as you highlighted, is humility in accepting that, learning and updating our thoughts and sort of beliefs about a given area, a given topic, that's a good thing. And we should be saying something different than we were 20 years ago in many of the areas where we work because we're making progress. And so I think we're all excited to see, the progress that will continue to be made at Duke and with Lauren's teams that are working on some really exciting methods around AI and machine learning and trying to incorporate an equity perspective in how do we bring these innovations in diagnosis and screening to communities that may benefit and aren't currently benefiting from those now. So I'm really excited to continue to watch their progress.
I think that's right. And I think the last thing I'll say before we think, forward about other episodes coming is that the goal of the scientific method is to disprove our hypothesis. We start with assumptions and things we think we know. And then more times than not, we realize we're not right. What we have observed or something I saw in practice is not really how it might work. We've done that for cardiovascular disease. We've done that for infectious disease. So my sense here is that, we sometimes forget that the math is, you have to prove beyond a reasonable doubt almost, 95% of the time, thinking about the statistical modeling, you're going to be wrong. You have to have a, greater than 95% certainty that this thing has been disproved or it has been proven to be something that might help people. So that's where I get the humility, having conducted studies where I thought we knew we were going to make a difference and then we didn't. It's humbling to understand just how far you can go with what you think you know, and then you learn as you do the experiment that that's not the way.
That learning mindset is powerful. Thanks for joining us for this episode of Beyond the Endpoint. As always, we encourage you to share your thoughts or topic recommendations by emailing us at beyondtheendpoint@duke.edu.
And don't forget to subscribe to the podcast on SoundCloud, Spotify, Amazon Music, or Apple Podcasts. You can also connect with the Duke Clinical Research Institute on LinkedIn or by following @DCRI News on X and Blue Sky.
This has been Beyond the Endpoint. Resources related to this episode are available on dcri.org/BTE. If you have any burning questions about clinical research or healthcare, drop us a line at beyondtheendpoint@duke.edu. We'd love to address your questions in a future episode.